One of 6 principles of the IDEA, appropriate evaluation applies to the evaluation of students to both determine eligibility for special education services and assess their educational needs. Provided is an overview of the evaluation process, as well as applications for early childhood and culturally and linguistically diverse students. It was only 42 years ago that children with disabilities were not allowed to go to public schools. Instead, they had to attend special institutions. Things changed in 1975. President Ford signed the Education for All Handicapped Children Act, which gave children with disabilities the right to attend the school in their own neighborhood. In 1990, the Education for All Handicapped Children Act was renamed the Individuals with Disabilities Education Act, commonly known as IDEA. Amendments and improvements to the Act followed, including child find, which is required by IDEA but not funded, so states develop and implement their own policy for child find. Most people are under the assumption that the child find provision is geared toward preschool children only. But infants and toddlers birth to 2 years, as well as students ages 3 to 21 years that are suspected of having a disability, are also the responsibility of child find. Once a child has been identified as possibly having a disability, we need to determine what areas need to be assessed. We look at test scores, information from parents, and observations in the classroom and other settings. We must also rule out lack of scientifically research-based instruction as a reason for the child's difficulty in learning. Parents must sign informed written consent before testing can begin. They must understand why the testing is necessary, what tests will be done, and their legal right to revoke in writing their consent anytime before testing is completed. In Idaho, testing must be completed and eligibility determined no more than 60 days from the signed consent. There must be a variety of assessments used that are valid and reliable in all areas of the suspected disability. In Idaho, there are 15 disability categories, including autism, intellectual disability, deafblindness, developmental delay, emotional disturbance, specific learning disability, and speech impairment. Appropriate evaluation serves 2 specific purposes. It determines students' eligibility for special education services and assesses their unique educational needs, including accommodations, modifications, and related services like adaptive physical education, speech therapy, or occupational therapy. It is critical to quickly connect children birth to age 5 to effective interventions. According to research, the sooner a child receives services, the higher her chances are for the best possible student outcomes, as well as reducing the incidence of future problems in learning, behavior, and health. Research also states that many infants and toddlers eligible for services are not enrolling in early intervention, partly because of the confusion parents face in dealing with multiple agencies. By keeping services under health and welfare, pediatricians can identify, screen, and refer children at the earliest stages of life, lessening the burden on parents. IDEA requires that evaluations accurately capture a student's educational, developmental, and functional ability. A set of assessments, coupled with parent interview and observations of the child in her natural environments, her home and childcare program, yields this information. Standardized tests produce data for eligibility, but used alone lack the information for meaningful student goals and instructional content. This leads to an inefficient gathering of information, wasting time, energy, and resources for the lead agency and for the families. The focus must always be on the whole child. Authentic assessments provide the functional information through parent interview and observations in natural environments. In this manner, the child and her family receive a well-connected service from beginning to end. Another group that provides a challenge for special education evaluation teams are those that are considered culturally and linguistically diverse, commonly referred to as CLD. The primary concern for teams evaluating CLD students is to avoid misidentifying differences in culture and language as a disability. IDEA mandates that evaluations be non-discriminatory and in the student's primary language or mode of communication. However, research shows that CLD students are overrepresented in special education, meaning that evaluation teams may be failing to accurately determine the educational needs of CLD students. One possible reason for this fact is that the majority of evaluations are developed for students who are members of mainstream American culture and native English speakers. Even when evaluations are developed in other languages, cultural differences are often not taken into account in the test design. Additionally, the team may not understand the student's fluency in either their native language or in English and use an inappropriate evaluation. Research shows that English language learners develop the ability to engage in social language several years before they are able to fully understand and use academic language. So, what is an evaluation team to do? In addition to testing the students in their primary language, teams must use evaluations that have been designed with CLD students in mind. They should also consider the amount of knowledge of mainstream American culture that the evaluation requires. In addition, the evaluation team should include an expert in how students learn a second language. This will help the evaluation team to distinguish between normal patterns in the way that CLD students adapt and learn and avoid misidentifying this as a learning disability. Making the evaluation process appropriate varies depending on the student being evaluated. Others, like child find and informed consent, remain the same in each case. Appropriate evaluation is important because it lays the foundation for accurately identifying and providing critical supports for students in need of special education.